Implants have been around for a while, and but just recently, I would say in the last 5, 6 years, I believe they're the standard of care for a missing tooth. Why do I say that? Well, for two reasons. Because the other option for something that's permanent in your mouth is a bridge. A bridge, if a person's missing, let's say they have their front tooth knocked out. They have their front tooth knocked out, their options are we can put an implant in and replace that tooth. The advantages of doing an implant in that situation is the person has a one-tooth problem, they lost the tooth, and now we're replacing that one-tooth problem with an implant. An implant, when it fuses with the bone, is generally going to be there for the rest of the patient's life, barring injury, as long as they make an attempt to keep it clean and healthy. The alternative, doing a bridge, involves taking the two teeth next to where the tooth was lost and shaving them down for crowns and putting a false crown in between and having it 3 crowns essentially fused together that then are cemented up there. That's a lot quicker than doing an implant. It's generally a little bit less expensive, although the cost is getting pretty much the same now. But the big disadvantage is you're taking a one-tooth problem and you're turning it into a 3-tooth problem down the road. Because if anything goes on with either of those 2 teeth that's holding the bridge in place, then it's the whole thing needs to be redone or addressed. And we found in our studies and looking at bridges over the years that the problem with bridges is after 10, 15 years, generally they're going to have to be redone, either because it's an aesthetic problem in the front of the mouth or just wear and tear with the back of the mouth. And so what would be better, to have your natural teeth and an implant, or to have 3 teeth that need to be redone over and over again? I think people in general, though, a lot of times it does come down to cost and what does my insurance cover. What we're finding now, though, is a lot of the insurance companies are now starting to cover implants. But given the two, I always tell people, if you look at the investment, if you're going to invest in the implant, that's something that's going to last you a lot longer, whereas if you're 25 years old and you just got your front tooth knocked out and you do a bridge, that bridge at minimum, unless something changes dramatically in technology, and it doesn't look like it's going that way, you're going to have that bridge done 2 or 3 more times over the next several decades. And it's the same thing with partial dentures, because that's the other solution sometimes that people will choose because they'll want the least expensive. And a partial denture is nothing more than a denture, but it's only replacing partial or part of the mouth. The problem with partial dentures is they have clips that hook onto the good teeth, and those clips actually work the same way our tools do. And when you chew on them, they slowly loosen your teeth, and the teeth fall out, and then you're adding more teeth and more teeth and more teeth. And that's generally what happens until you don't have any teeth, and now you're into dentures. But during that time, you're losing bone. And losing bone then means more difficult to put implants in. And with inflation, you're going to spend a lot more doing that, and you're going to have a lot more complications with that than you would if you spent the extra money on the investment with the implant. So it's really just a matter of what you want for your health.